ahead and get started. I want to thank you for joining us today on this virtual presentation. And I want to thank our panelists. We're going to talk about aging with choices and some enhancements we're offering here at Collington moving into 2023. So with us today, I have Megan Barbour. She is our COO. I have Dr. George Toller. He is our medical director with Medstar Health. And I have Michelle McKenzie, who is our assisted living administrator. So I'm going to go ahead and let the experts do the talking. And if you have any questions following this, please just put in the Q&A your questions, and I will capture those and we will get back to you following the presentation via email communications. So take it away, guys. Thank you.
Thanks, Sandy.
Thank you.
Thank you, everyone who's tuned in. Good afternoon, good morning, depending on where you're joining from. As Sandy said, I'm Megan Barbour. I'm the Chief Operating Officer here at Collington. I've been at Collington for just a little over 4 years now. Started out as the Director of Health Services and the Director of Operations. So I oversaw health services as the nursing home administrator, as well as culinary services. And I'm going to let Dr. Toller introduce himself a little bit further and talk a little bit about his background. And then I'll have Michelle introduce herself further as well. Dr. Toller.
Okay, thank you. So I've been with Collington since April, very much the newcomer here. However, I've been a geriatrician since 1980. So it's over 40 years. I've worked in a variety of different settings, nursing homes, long-term acute care, hospitals, hospice, and more recently, care at home. So we have a home-based primary care program in Washington and Baltimore, and I spend part of my time there as well. But most of the time I take care of the residents in the assisted living and skilled nursing facility at Collington.
Thank you, Dr. Toller. Michelle, would you like to introduce yourself a bit further?
Hi, my name is Michelle McKenzie. I'm the assisted living administrator. I'm also a registered nurse. I've been here at Collington over 18 years, going on 19 years. I like to pride myself as being a Collingtonian. I always tell people that I'm a leader without a title, as in such that I'm always up and ready for whatever task. That means if I come in and if I'm the GNA on the floor during COVID, we just wore multiple hats. So I always pride myself as that leader without a title. My number one aim is always to make sure we're serving and meeting the needs of our residents. One thing I've always prided is that Collington, we've always tend to be ahead of the game, which means that, you know, we've always been making sure that we can care for our residents, and we've always tried to foster more like an agent in place in our assisted living.
Thanks, Michelle. All right, so today we're going to talk a little bit about the assisted living enhancement that is coming for Collington. So we're going to talk about what is changing and why, what this means for Collington, what everyone can expect during this process. And then we'll have a little bit of panel discussion between Michelle, Dr. Toller, and myself. So background and overview. So what is changing? So in 2017 and 2018, Collington embarked on a strategic plan. The part around health and wellness, setting it up as one of our pillars of success, was a program that was absolutely critical for Collington, and it was a major factor in many residents' decision to move here. We have a holistic approach, and our mission is to foster and support residents in achieving their own personal goals for living well, with coordination of services and partnerships both on and off campus. We want to deliver on this promise by making timely decisions now about our structure, practices, and getting creative in the offerings that we have on campus and off campus. We've really found that we can't do it all. We aren't an expert in every single thing, but we pride ourselves that we have partnerships who can be an expert in those areas where maybe we aren't. And really it takes a village for everybody to have successful care. And so we've got some really strong partnerships that we're going to talk about here in a few minutes. So in 2018 to 2020, we had a health service alliance that was an alliance of residents and team members that came to fruition because of the strategic plan. So the first focus was on the quality of care in the Creighton Center. And the Creighton Center is our health center, where right now is home to both skilled nursing and assisted living. The second focus was on repositioning our Creighton Center. So our Creighton Center, we were looking at updating the environment of it to really match a more modern philosophy, a less institutional model, and really come to a more correct bed count, if you will, based on what we were seeing in the clients we were serving. So Collington has traditionally been a skilled nursing provider for just Collingtonians. And then a few years back opened its door to external clients as well. And over the past few years, we've really found ourselves mostly serving external clients, with most of our Collingtonians being served in assisted living. Used to be that people transitioned through a continuum by moving into independent living, then to assisted living, then to skilled nursing or the traditional nursing home for end of life. But we haven't seen that model for several years now. We're able to allow residents to move into assisted living as needed and age in place thanks to those partnerships that I mentioned. So in the repositioning of the Creighton Center, the Health Service Alliance looked at right sizing the skilled bed counts. So again, that's the nursing home. When I say skilled beds, I'm talking about your traditional nursing home. Currently, Collington has 44, and the goal was to go to 9 and eventually go to 0. I remember at my first meeting at the Health Service Alliance saying that whatever we built, whatever we repositioned, we need to make sure that probably 5 years from now, it could be flipped to be an assisted living, as that was really what we were seeing, what our market studies were telling us, and what the trends were starting to show. And then COVID just exacerbated that even further. And so in July of 2019, we started on master planning. This was around the campus, the infrastructure and programming that would not only support the repositioning of the Creighton Center, but looking at the entire campus as a whole. So the external drivers that really set the stage, of course, were COVID. COVID, I think for everyone working in a skilled nursing facility, really recognized some of the gaps, some of the weak areas, and really made us change our mind around the model. We had to be flexible. We had to think differently. We had to get creative to really be able to serve our residents wherever needed. And we saw less and less persons going to the nursing home, not only for long-term care, but for that short-term rehab, that skilled nursing need. As more people were already going home on home health services with COVID, everyone was going home with home health. Of course, increased regulations has also made skilled nursing a challenge. And regulations are good. I don't want to say that all regulations are bad, but over-regulation sometimes can be a challenge. And my best example of this is if you're in skilled nursing and you want to have a glass of wine, we have to get a doctor's orders for that. Whereas if you're in assisted living, we have the Ivy Lounge, which is just right down the hall, and residents can go right there and get a glass of wine. So it's a much less regulatory environment. Workforce. We are not alone at Collington when we've had challenges around workforce, as everyone has across the country. We've gotten really creative to be able to serve our residents and external clients to make sure that we always had staff in place as needed. But we've seen that more people are attracted to work in an assisted living than in a nursing home. And of course, the cost to operate a skilled nursing home has continued to increase while reimbursement continues to decrease. So in the 2022 State of Senior Living and the Senior Living Capital Markets, only 2 of new communities built in 2021 actually included a skilled nursing component, according to Ziegler Securities. We're seeing more and more CCRCs being built with an assisted living attached, and more skilled nursings really becoming a standalone skilled nursing to serve that high acuity, that next step down from a hospital, where again, you're seeing more long-term care take place in assisted living with those partnerships. We're also seeing the trend in consumer preferences. More residents want to stay at home, and studies have shown how much better it can be for you to get care at home. When there's things with remote patient monitoring, visiting specialists, Of course, people want to age in place, and aging in place may not look like just aging in place in your independent living home. It may look like aging in place in your assisted living. Collington is unique that we are assisted living level 3. And what that means is that we can take a higher acuity resident to be able to meet their needs in our assisted living. The reason that we can do this is because we staff with licensed practical nurses and also registered nurses around the clock. A lot of communities will use what's called a CMA or a CMT. So those are certified medical associates or certified med techs to be able to pass medications and provide care. But we at Collington have always said that we wanted to staff and run our assisted living with the highest quality, the highest regulatory compliance. So we've matched everything that we've done in our skilled nursing to assisted living because it's really a continuum of care and not a silo, so that we're being sure that we're working as a team. I always say to residents, does it matter what the license is that you're being cared for under, or is it more important that you're getting the care you need when you need it in a comfortable setting? So in August of 2022, there was board decision that came to be accelerating the Health Service Alliance recommendation to de-license all 44 of the Creighton Center skilled beds. We are increasing our assisted living bed count by 12. Currently, we have 65 assisted living beds, and we're going to be increasing to 12 beds based on market studies, trends at Collington, and information to make sure that we have ample rooms available and homes available in our assisted living should Collingtonians need it. The biggest change in de-licensing is that we're moving away from really taking care of external clients. So persons who don't live here at Collington, but maybe came in from the community to use that short-term rehab benefit. We've found that we are very good at taking care of our Collingtonians. We are very good at taking care of external clients, but our mission is really to serve our Collingtonians. So we're realigning to serve our mission. Of course, there's some challenges and benefits that come with skilled nursing in comparison with assisted living. As mentioned, there's a lot of constantly changing regulations, the drastically reduced reimbursement, making sure we're providing adequate staffing, reporting requirements, and paperwork. Again, a lot of these things don't stop just because we're doing assisted living. They may decrease or they may be able to be done in a more efficient manner than in skilled nursing. The benefits to care in assisted living is also strong. Here we believe in people over paperwork. Our assisted living has recently been extended as far as the electronic medical record system, Matrix Care, so that we can access records seamlessly, that we can get the care that we need, the information we need from those medical records from independent living, flowing over into assisted living, whereas before it was much more in the skilled nursing realm. It's also a cheaper for residents. It's a less costly environment because of that. And the quality environment, again, is more homey. A lot of times in skilled nursing, you think of that short-term rehab, you think of more of a hospital room, a hospital environment because of all the critical infrastructure that you may need there. Whereas assisted living is really your home. You're coming there to live. We can also do short-term needs there and have it set up in a much more homey environment. And of course, residents are receiving care in a less medical environment, and residents and the community save on costs. And those are the two biggest drivers of this decision. So skilled nursing versus long-term care. So right now at Collington, we offer both. We offer skilled nursing and long-term care in the Creighton Center under that skilled license, which is for the 44 beds. Skilled nursing, again, is that acute short-term medical needs, such as a post-operative care. It's billed to your insurance, could be Medicare, and the average length of stay is 21 days. Long-term care nursing needs are really for more of an ongoing, what we call custodial total support care. It's generally not covered by insurance, so it's typically a private pay. And it can also be provided in other settings than a nursing home, again, such as our assisted living neighborhood. And we see this often here where our residents, when they move again to assisted living, they're not going from assisted living then to skilled nursing. They're aging in place and able to remain in the assisted living in their home throughout their lives. So the number of skilled nursing beds, again, is 44. Our average skilled nursing daily census has been 13. The Collingtonians that are in skilled nursing has been around 8. And all are receiving long-term care, and all of them will be able to qualify to be able to be assessed and to be able to be in assisted living. So that's huge. So we're not closing our doors. We're essentially delicensing, and the residents that are in long-term care will have their needs completely met in our assisted living. The average monthly loss in skilled nursing has been around 150,000, give or take, because again, we still have to provide that care. A lot of this sometimes has to do with insurance. So a lot of managed care contracts don't pay or reimburse, if you will, as highly as, let's say, Medicare or private pay, so it may not cover your cost. For instance, if a resident comes in on a managed care plan and their insurance says that their stay has now ceased, they've extended all the days that they've qualified for this skilled nursing care benefit, they're going to be discharged. But let's say that the resident doesn't have a discharge plan ready, or our social work team is still working to make sure that everything is safe for that resident or that external client to go home. There either would be a private pay situation, or we would maybe not get reimbursed. So again, this could be a very high cost to Collington. Whereas in assisted living, again, often we're able to meet those needs doing a respite care, a short-term care for Collingtonians as well. So what will this mean for Collington? So over the past 4 years, virtually all Collingtonians who have spent time in skilled nursing could have received those services in our assisted living with some additional support. Again, those partnerships are huge, such as our partnership with Medstar, and we'll talk a little bit about what all those partnerships are in just a moment. Decision does not change the care and services provided to Collingtonian. It really only changes the location. 5-star rating. So what does this 5-star rating mean? So a 5-star rating is a Center for Medicare and Medicaid Services rating, CMS, that rates skilled nursing facilities. So because we will not have a skilled nursing facility, our star rating will not be published because it's attached to that. Now, one of the things that our skilled nursing is required to have, along with our assisted living due to regulations, is what's called a QAPI program. That's a Quality Assurance Process Improvement Program. This is where we look at our trends and our data, everything from infection control to wound management to falls, and we really drill down for root cause analysis. We ask the 5 whys, if you're familiar with that, to really find out what happened, why did this occur, to really be able to put things in place for preventative measures if needed, or again, to be able to serve residents in a way that they need. So Collington has always done this on the assisted living side as well as the skilled nursing side, but as required in assisted living only twice annually, we do this monthly. So it's an interdisciplinary team, which has nurses, social works, dietitian, facilities, and our environmental services leadership on that to talk about all the different aspects. So while the 5-star rating is really only attached to skilled nursing, I truly believe that our assisted living has always been running at a 5-star rating. And I believe it's only a matter of time before assisted living will come up with their own rating as well. And this will continue. We'll continue doing the analysis, continue doing that work with our team throughout. It will still remain a continuing care retirement community. I get this question a lot. And I'll talk a little bit more about what skilled nursing will look like, having it not here on campus. So for our level 3 assisted living, this is a chart, if you will, of our 3 levels. So there's a low level, which requires an occasional support, moderate, which may require more assistance, and then a higher level, which requires a frequent higher assistant level. Now in Collington, we typically have neighborhoods. One neighborhood, for instance, is called Brandywine, which is at a home to low level. We have a moderate level, which is our Barbour or memory care neighborhood. And we have Potomac, which is our higher level. So that's typically where we see those residents. However, because we're a level 3 across the board, we can serve residents in any neighborhood, any level that they have. So if they live, let's say in Brandywine, which is typically the level 1, and they have an acute issue that perhaps now they've transition to a level 3, we can still care for them there in that home. And that's really important because you're not moving throughout the different neighborhoods. You're able to get the care you need where you are, should you need assisted living. So for Collington's in the Creighton Center, for now, what this means is that they'll be assessed for their long-term care needs for which neighborhood is best and most appropriate for them, and we'll provide that care for them in those assisted living neighborhoods. That's going to be taking several months for us to be able to complete, and we'll be assisting with those moves for our 8 Collingtonians that are in skilled nursing now. For team members will move with the residents to assisted living. So the neighborhood in skilled nursing that was before called Shenandoah, and primarily it was used for our COVID unit, is now going to be relicensed as assisted living. So we'll be adding that neighborhood as well. And we hope that this will be decreasing our agency team members. We will continue to have team members in place as we need them, even if that means agency. But we are hopeful that most people will be able to recruit easier for assisted living as the trends have shown, and be able to decrease our agency use. And we will have 2 skilled partnerships. So going back to the piece about what skilled nursing will look like at Collington. So we have confirmed 2 skilled nursing partnerships. These are standalone skilled nursing facilities who really specialize in that high level acuity, that next step down from a hospital. One is called Autumn Lake Healthcare, located in Crofton, Maryland. And the other one is Future Care Capital Regional, which is located here in Bowie. And we have a contract with both of them. So we're a preferred partner. They're our preferred partner. The residents will always have a choice for wherever they would like to go if they would like to go somewhere else. Both of these offer a dialysis unit on site. And Future Care also offers the ability for ventilators. Both of those items being things that currently Collington is not licensed for, could not provide here for our residents. The really unique thing that's going to really tie everything together is that we are going to be able to have our team members really navigate the care for residents, so that if they choose and need to go to one of these skilled nursings, that they come back to Collington. Our nurses can visit, can get training, our transportation can take spouses and friends, so that way they don't feel like they're at a different location and not a part of our community. We want to keep our arms around them at all opportunities. And we're hopeful that we don't have to use this. Hanover, which is one of the Kendall facilities, did this model and delicensed their skilled nursing back before the pandemic, right at the beginning of 2020. And they had the partnerships as well, but thankfully they've not been able to have, fortunately, they have not had to use them because they've been able to care for their residents at home, meet those short-term needs. Some of this is going to be education to physicians. Some of it will be, again, those partnerships like home health that will help to partner for our nurses in assisted living, and getting creative. And because we have the Medstar partnership here on campus with the clinic, we have a really great continuity of care across our whole continuum. Other key partnerships are Powerback Rehabilitation. So this is our outpatient rehab company who just started in October, and they have specialized in really focusing on assisted living for rehab, and also for outpatient for independent living. So if you have outpatient rehab needs, such as speech pathology, physical therapy, occupational therapy, that is right here at Collington. And for those who may be needing a skilled nursing visit and come right back, they can get their outpatient right here. Of course, we have the Medstar partnership again, which is key. This has also been extremely valuable for after hours and weekends. That's the question, right? What do I do after hours and on weekends? How will I get my care? What if I'm in independent living and I have an acute issue, or I go out to the hospital? We're very fortunate that we have a 24/7 availability for a hotline that a resident can call directly themselves if they're in independent living or again in assisted living, and can contact a physician directly, so that if somebody goes out to the hospital, our physicians at Medstar are able to continue to follow them if need be. And of course, we have Prince George's Hospice, which is also right here on site at Collington. You always have choice when it comes to hospice, but Prince George's Hospice, which originated out of Montgomery County Hospice, is located here on site for any Collingtonian that needs that care. And they're also available for external clients who are not Collingtonians. So maybe you have a question about hospice for a loved one or a friend or another family member, and they're here to answer any questions you have for that as well. We also have Valora Wound Physicians. This is an entity out of Florida, and they have been our wound physicians for many years now. They're a great partnership so that if we have wound care in assisted living, we're able to meet those needs just as we would have in skilled nursing. And of course, home health, home care. So currently at Collington, we do not have a preferred provider for home health, home care. We have many residents that have chosen to use various home health and home care agencies. And this year we will be choosing a preferred partner and looking for one that really works well with our continuum. Again, residents will always have choice, but we want to be able to have those preferred partnerships so that there is seamless continuity and to provide any care needs where maybe we have gaps in services. So the process as far as what we can expect. So we've started the processing of delicensing. We're going to talk about those details on the next slide. We have filed paperwork to increase our 12 assisted living beds to get that license, and we are waiting on information for that. And we've coordinated with current Collingtonians in skilled nursing. We've met with those family members and residents to talk them through what the next steps will be. And we'll be working with those assessments that Michelle will be leading for those residents to find where their most appropriate neighborhood will be in assisted living. We've coordinated with state and federal regulatory agencies. Again, we're completing the review of potential partnerships and establishing those partnerships for transfer agreements. We've communicated steps and transitions to residents and team members, as well as external partners. And we're supported by Whiteford, Taylor, and Preston's Continuing Care Retirement Community Industry Group for legal expertise. So we don't have to go it alone. The process could take several months. We're hoping that completion will be in 2023. However, the pace is really at the discretion of the Department of Aging and the Department of Health. We have a frequently asked questions form that's available, and I'll have Sandy to distribute that out to anyone who's on the call. And if you have questions, you can also send those to ccquestions@collington.kendall.org. Please give us about 24 hours to respond back. And we're going to update those FAQs as we have small group meetings throughout October. So throughout October, we've got small group meetings for our independent living residents. We're holding a Zoom for our assisted living families. We have had individual meetings with our skilled nursing residents. And we are also having small group meetings with our team members. And then of course, we're having our Zoom today for potential residents as well, because we want to keep everyone informed, because there's a lot going on with change. Change can be very scary. And especially not knowing the timeline of things can sometimes heighten that as well. So we want to be as transparent about everything as we can be. We want to make sure that everyone understands that they're going to get the care they need throughout the entire process. And we're looking forward to be able to have this enhanced assisted living, which is really going to serve what we have found to be the trend here at Collington. So I know that we don't have the ability on here on the call to do Q&As, but what I wanted to do was just to open it up a little bit for some panel discussions with Dr. Toller and Michelle, just to kind of give their thoughts on the overall process, how it's going, as far as things they've been involved in as well. And I will start with Michelle, and Michelle has been a really huge driver when it comes to answering resident questions. She's been with me in a lot of the small group meetings and really has a great understanding for what our Collingtonian residents need as far as assisted living. So I'll let Michelle share any thoughts or anything that she would like.
Hello, everyone. And again, as Megan said, and Megan, you did an excellent job with just pointing out all the clear factors. One of the things that I always prided myself with working at Collington is one of the few, if not probably the only one I know, that have always in the 18 years that I've been here consistently staffed with an LP and an all 3 shift, in addition to having a freestanding RN supervisor. So that has always allowed us to take a more proactive approach versus a reactive approach. Again, in my 18 years, I've probably had 1 or 2 residents who was actually transitioned. And that was just based on the residents' Maryland order for life-sustaining treatment, what their wishes were. You know, we here at Collington, we have an interdisciplinary team approach to everything. Each morning, the panel, which consists of the dietitian, physical therapy, occupational therapy, speech, the director of nursing and myself, we're sitting and we're discussing each resident to understand what's going on and to see what we can do from a proactive measure. Medstar has been excellent. They're always here when there's a significant change. You can call Dr. Tyler. I remember one family said, he actually answers his phone and he's so nice. And that's like something that's just universal across. So, you know, we're sitting here, we're taking this approach to say, okay, pharmacy comes in, we're doing a medication regimen review, and we have a contracted pharmacy that does that every 3 months. Dr. Tyler comes in and says, hey, look at this person. Is this medication necessary? What are the blood pressure readings? Should we maybe taper this down? So we're making sure we're doing all that. You know, one of the things we have again is radiation physics. So if there's something that we need to know, we can do the stat chest x-ray, we can do an EKG, we can do an ultrasound. So that's going to decrease the hospital transfer for our residents. We have a licensed dietitian. So if someone has been seen by speech, and guess what now? We need a puree diet. We need some Nectar thick liquid. That is what we have been doing in our assisted living. So this is not something new. It's more like, hey, welcome to the new era. You know, we have, again, podiatrist service. We have a mobile dentist. You know, we have now free partnership. And the residents, not because you're in assisted living, you still have the freedom to collaborate with your outside specialists. You can go to your cardiologist, your oncologist, your neurologist, and we have an excellent team. So we're only as good as the team that we work with. So our discharge process begins from in the community. If you had a fall or anything and you're transferred out, our social workers are following you through the entire process. Whatever hospital you are, we're working with that discharge plan and we're getting daily updates. We're seeing clinical notes, we're seeing everything. So we can then prepare for you returning back to Collington. So like I tell you guys, this is something that I've been doing. This is something that we're welcoming you. It's work. I've been here for 18 years and I tell you, I have residents that are up to 108. So it speaks volume. When you're admitted, because they're Collingtonian, they're very healthy and they stay as long as they can, independent. But once they do decide to transition at 96, and they're here till 108. So, you know.
Thanks, Michelle. That's a great way to summarize it. Dr. Toller, I'll turn it over to you for your thoughts.
All right, thank you. I think that Collington is really at the leading edge of change. Our society has recognized that this move towards institutionalizing and medicalizing long-term care was probably a mistake. Unwinding it is going to be a very long process. But at Collington, we can do that very quickly. The administration is nimble and the community is very much invested in understanding the changes that are happening. So we're able to affect the future much faster than I think the rest of our communities, surrounding communities. I saw that there were some questions about skilled care. And as I had said, we are moving our geriatrics programs more and more towards home-based primary care. And the reason for that is that the technology has changed dramatically over the past 20 years, where virtually everything is mobile and point of service. And so it's very easy to get the diagnostics that you need. We talked about the imaging studies with radiation physics. Laboratory has been very easy to obtain here and very responsive to our needs, as have the pharmacist. And so we're able to provide the kinds of services where previously you could only get in skilled care. Now we're getting in the community and in assisted living throughout. So the question about ALS care, the only reason that somebody would need to go out is if they chose to go on a ventilator. We don't do ventilators at Collington. Dialysis is something that you can go to outpatient dialysis. There is a very strong movement now to do dialysis at home. And they're changing the reimbursements to make that happen. So there are very few needs for the skilled facility any longer. And that's what other long-term care and continuing care retirement communities have found. So I applaud Megan and the Collington leadership in moving in this direction. I think it's the right thing to do. And it works medically, and it very much, I think, is in concert with the idea of aging in place in a more home-like environment. So I'm looking forward to the future here.
Thanks, Dr. Toller. So thank you, everyone who attended today. Again, if you have questions, please feel free to send them to ccquestions@collington.kendall.org. I'll have Sandy send out the FAQ as well. Again, there's a lot of questions. You probably have a lot of questions that may be specific to your care, your billing, anything like that. We're happy to answer all of those questions that you need. The last thing we want is anyone to feel like they've got a question that's unanswered. So please don't hesitate to reach out. Again, no matter what care you need, where you're at, when you need it, we want to be able to provide that with you. And we hope that we get to meet you as Collingtonians at sometime soon. So with that, I'll turn it over to Sandy.
Thank you, Megan. Megan, could you please share that email address again so folks can write it down? And everyone, if you want, just take a few seconds to grab a pen and paper. And then I kind of want to, I want to close it out with some gratitude. So anyway, What was it, Megan?
I'm going to share my screen. Let me try this one more time. I hope I can get it shared here because that way everyone can see it. Can you see my screen, Sandy?
Yes.
All right. So that's ccquestions@collington.kendall.org. I am monitoring the email address. So I always say, give me about 24 hours between Monday through Friday, but I also, as Sandy and Michelle could probably attest, even Dr. Toller, I tend to answer my emails evenings and weekends as well, because I never want someone to go without what they need. If I'm not the most appropriate person to answer the question, I will get the answer for you or send the question to the most appropriate person, because we really have a team of experts here at Collington in all areas, and really proud to work with this group. So please don't hesitate to ask any question at all. We're happy to answer those for you.
And I might have forgotten, Megan, to include that we do have a secured memory care unit. So again, we have residents in all stages of their dementia. So we have, years of experience in caring for that. Residents with Parkinson's, so yes.
Thank you, Michelle.
Thank you all so much for, to the three of you, for sharing what we think is, as Dr. Toller mentioned, the trend of what we're seeing for care. And I just want to share that each and every one of you are such an important part of how we came to this decision. And Michelle McKenzie gets tired of me using this example, but this is who we are when we talk about the quality of care that we provide. Person-centered. It's been that way before we've even talked about this change from skilled nursing. And Michelle, could you share a little bit about what you've done, some examples with memory care of what you've done down in the Barbour to help residents as they adapt? Because I love this story. You know which one you're going to tell already.
Yeah, we had a resident. She was, again, one of our Collingtonians. She lived independently. She had a great passion for cats. Remember when she transitioned over, we got a mechanical cat, and I was like, oh my God, this is not going to work. It's, she's going to recognize it. But lo and behold, the cat came and she was like, oh, Kitty. She was so, the emotion was just, it was just touching. I remember when Sandy came up, because the cat was so real looking that she actually kept trying to feed Kitty. She would take Kitty to my office every day to make sure Kitty said hello. She wanted to make sure Kitty was checked up and Kitty was doing okay. So, we make sure we try to go above and beyond. And I've always said, see the resident, not the disease. So you remember who that person was. We're not looking at someone with dementia stage 3. We're looking at the individual, what that person did, what they serve. Is it something where we know that this person like going out for walks? We're having them to go out for walks. We're taking them down to the Ivy Bar so they can have that glass of wine and they can just do the stuff that they enjoy doing prior to their admission to the memory care unit.
Thanks, Michelle. Thanks, Michelle. And I want to thank Dr. Toller because, you know, with you having the expertise and the background from Medstar and the ability to provide some outside of the Collington view of what's going on in the medical industry, we appreciate that. And of course, you come from the largest or one of the largest medical providers in the state of Maryland. So, and even the DC area. So we thank you so much, because when Dr. Toller walks into our community, he's not coming in as just a Medstar physician. He's coming in as part of our family here at Collington. So thank you for taking that time to share. And I want to thank Megan, who came in, you know, how many years ago, Megan? Has it been 3 or 4?
4. Yeah, it's 4 years in September.
Yeah, and again, similar to Dr. Toller, she had perspective from, you know, what the trends were showing for how we can provide quality of care and be, as Dr. Toller mentioned, nimble. So, you know, her leading that charge of us providing the care that we need to do for the person, we appreciate that. So we're excited about what this holds for us going into our new chapters of Collington. And as Megan mentioned, feel free to email that email address she provided. We have some other events coming up, but we thought this was really important to share with you in real time. So thank you everyone for attending, and have a great day.
Thank you.
All right, thank you. All right, bye-bye.